In this video, we are going to discuss about circulatory route, blood flow through the heart, blood flow to the heart or coronary circulation and venous return. First is circulatory routes. There are two types of circulatory routes, coronary route and systemic route. Coronary routes. The heart makes up only 0.5% of the body's weight, yet receives 5% of the body's circulatory blood. This rich blood supply is another reason the heart can stay aerobic. The heart's myocardium is not fed by the blood passing through the chambers. It has its own circulation route composed of coronary arteries and veins. We will be covering in detail in coronary circulation. Next is systemic route. These routes carry blood from the heart to tissues in the body other than the heart and back again. The simplest route goes like this: heart to arteries, to capillaries, then to veins and to heart. Example of this circulatory route. The blood leaves the heart's right ventricle to travel through the pulmonary trunk to pulmonary arteries, to arterioles, then to capillaries, covering air sacs in the lungs. Oxygen is loaded to the blood within the capillaries and carbon dioxide is unloaded. From these capillaries, blood travels through venules to pulmonary veins to the left atrium of the heart. There are two types of alternative systemic routes in the body: portal routes and anastomosis. Portal routes. A portal route contains two capillary beds before blood is returned to the heart. In this type of circulation, blood travels in the following route: heart to arteries, then to capillaries, then to intervening vessels, then to capillaries, then veins, and returning to the heart. Because there are two capillary beds, this type of route allows materials to be exchanged twice between the blood and tissues before returning to the heart. Example of portal routes can be found between the hypothalamus and pituitary gland, in the kidney, and between the intestine and the liver. To better understand portal routes, take a close look at the example of the hepatic portal route between the intestine and the liver in the figure. In this route, blood travels from the heart to arteries, then to capillary beds in the small intestine and other digestive organs. Here, digested nutrients are absorbed into the blood through capillaries. Blood then travels through small veins leading to the hepatic portal vein, that is the intervening vessels, to capillary beds in the liver where the nutrients are processed. Blood then exits the liver via the hepatic vein on its way back to the heart. Blood travels through two capillary beds in this route before returning to the heart. Next is anastomosis. This type of alternative route involves vessels merging together. The three types of anastomosis are explained: arteriovenous anastomosis, arterial anastomosis, and venous anastomosis. Arteriovenous anastomosis is often called a shunt. It merges an artery with a vein, skipping a capillary bed. There may be a question as to why this would ever be done. After all, the point of circulation is to deliver materials to the tissues and take other waste away, and that happens in the capillaries. This type of route is used in the fingers, palms, toes, and ears in conditions of extreme cold. The capillary beds are then temporarily bypassed so that the heat is not lost. This is a protective mechanism. Arterial anastomosis form by the merging of arteries that supply the same body tissues. Such anastomosis provide collateral channels so that blood can reach these tissues. For example, if an artery is blocked by a clot or cut, a collateral channel may be able to provide required blood to the region. In the body, most organs receive blood from more than one arterial branch. What is the meaning of collateral circulation? Collateral circulation is alternate or backup blood vessels in our body that can take over when another artery or vein becomes blocked or damaged. Our collateral circulation provides alternative routes for blood flow. These routes can be found in the heart to make sure all parts of the heart are adequately fed. Arterial anastomosis develop around joints in areas where blood flow through a channel may be slowed or stopped by active movement. These anastomoses also commonly occur in the brain and abdominal organs. The arteries of the kidneys, retina, and spleen usually do not anastomose or have little collateral circulation. Blood flow interruption to these areas usually cause cellular death. Venous anastomosis. Since veins interconnect more freely than arteries, venous anastomosis are very common. It merges veins to drain an organ. Because of this, an occluded vein rarely stops blood flow or causes tissue death. Next is blood flow through the heart. The right side of the heart, made up of the right atrium and right ventricle, distribute venous blood, that is deoxygenated blood, to the lungs via the pulmonary artery, that is pulmonary circulation for oxygenation. The pulmonary artery is the only artery in the body that carries deoxygenated blood. The right atrium receives venous blood returning to the heart from the superior vena cava, that is from head, neck, and upper extremities, then inferior vena cava, that is from trunk and lower extremities, and coronary sinus, that is coronary circulation. The left side of the heart, composed of the left atrium and left ventricle, distributes oxygenated blood to the remainder of the body via the aorta, that is systemic circulation. The left atrium receives oxygenated blood from the pulmonary circulation via 4 pulmonary veins. Blood enters the right atrium of the heart from the superior and inferior vena cava. Then blood passes through the tricuspid valve to the left ventricle. Blood is forced through the pulmonary valve to the pulmonary trunk. Blood then travels through the pulmonary trunk to the pulmonary arteries, then to the lungs where carbon dioxide is unloaded and oxygen is loaded. Blood then returns to the heart from the lungs through the 4 pulmonary veins to enter the left atrium. Blood then passes through the bicuspid valve to the left ventricle, then by the force through the aortic valve to the aorta. Blood travels from the aorta to the rest of the body. Blood returns to the heart through the superior and inferior vena cava. The varying thicknesses of the atrial and ventricular walls are due to the workload required by each chamber. The myocardial layer of both atria is much thinner than that of the ventricles because there is little resistance as blood flows out of the atria and into the ventricle during diastole. In contrast, the ventricular walls are much thicker than the atrial walls. During ventricular systole, the right and left ventricles must overcome resistance to blood flow from the pulmonary and systemic circulatory system. The left ventricle is 2 to 3 times more muscular than the right ventricle. It must overcome high aortic and arterial pressures, whereas the right ventricle contracts against a low pressure system within the pulmonary arteries and capillaries. Left ventricle has to pump blood to whole body. Next is blood supply to the myocardium. The myocardium has its own blood supply that is called coronary circulation. Blood flow from aorta into the 2 major coronary arteries occur primarily during diastole, that is relaxation of the myocardium. The 2 major coronary arteries are the right coronary arteries and the left coronary arteries. The right coronary arteries and its branches supply the right atrium, right ventricle, the inferior portion of the left ventricle and the posterior septal wall and the SA node and AV node. In 90% of people, the AV node and the bundle of keys receive blood supply from the right coronary arteries. For this reason, blockage of this artery often causes serious defects in cardiac conduction. The left coronary artery divides into 2 main branches. The left anterior descending artery and the left circumflex artery. The left anterior descending artery supplies blood to the anterior wall of the left ventricle, the anterior ventricular septum, and the apex of the left ventricles. The circumflex artery supplies blood to the left atrium and the lateral and posterior surface of the left ventricles. The divisions of coronary veins parallel the coronary arteries. Most of the blood from the coronary system drains into the coronary sinus. It empties into the right atrium near the entrance of the inferior vena cava. If you take a close look at figure below, you will see two openings within the aortic wall. The pressure of blood filling the cusp of the wall as it tries to return to the heart during ventricular diastole forces oxygen-rich blood into the right and left coronary arteries. These two arteries then branch to form the capillary beds in the heart's tissues. 20% of the blood from the capillaries is directly returned to the right atrium of the heart from small veins. The rest of the blood in the coronary circulation is collected by the great cardiac vein and the middle cardiac vein and then emptied into the coronary sinus before entering the right atrium. Next is venous return. You now understand that the pressure created by ventricular systole propels blood through the arteries and capillaries. But what causes the blood to move through the veins on its way back to the heart? There are 5 mechanisms aid in venous return. First is pressure gradient. Even though there is less pressure in the veins than in the arteries, the pressure in veins due to the action of the heart does propel blood toward the heart. Then gravity. Blood moves through veins above the heart due to the gravity and it flows downhill. Next is thoracic pump. The chest expands every time a breath is inhaled. This increases the volume and decreases the pressure within the chest. As air rushes in to equalize the pressure, blood in the veins of the abdominal cavity is sucked into the inferior vena cava of the thoracic cavity by the same principle. Next is cardiac suction. Atria return to shape during atrial diastole. This creates less pressure in the atria than in the superior and inferior vena cava and the pulmonary veins. So blood is sucked into the atria from the veins. Next is skeletal muscle pump. This mechanism is especially effective in the limbs. Skeletal muscle action massages blood through the veins while the valves in the veins prevent backflow. As you are aware, ventricular contractions force blood out of the heart under pressure. That same pressure causes blood to continue on its journey through the arteries, capillaries, and veins as blood is returned to the heart. These are the 5 mechanisms aid in venous return.